Introduction to Mammography.
Mammography is a specialized medical imaging technique that uses low-dose X-rays to examine breast tissue. Its primary purpose is to detect breast cancer at an early stage, often before symptoms appear. The development of mammography has significantly improved survival rates by enabling earlier diagnosis and treatment. Let's trace the fascinating history of this essential tool in modern medicine.
Early imaging and the first mammograms.
The origins of mammography date back to the early 1900s, shortly after X-rays were discovered. In the 1910s and 1920s, doctors began experimenting with X-ray images of the breast. However, early results were limited by poor image clarity and high radiation doses. Despite these challenges, pioneers saw potential for non-invasive breast cancer detection.
Advancements in image quality and safety.
Significant progress was made in the 1950s and 1960s. Doctors like Dr. Robert Egan introduced improved imaging techniques with better contrast and lower radiation. The creation of dedicated mammography machines in the 1960s made exams safer and more effective. These advances paved the way for mammograms to become a standard part of women's healthcare.
Screening programs and widespread adoption.
By the 1970s and 1980s, clinical studies confirmed that mammography could detect cancers too small to be felt by hand. Large-scale screening programs were launched in many countries, leading to earlier diagnosis and better outcomes for countless women. Guidelines were developed for regular mammogram screening, especially for women over age 40 or at high risk.
Modern innovations and future directions.
Modern mammography now includes digital images, making exams faster and more accurate. Techniques like 3D mammography or tomosynthesis provide more detailed views and reduce false alarms. Ongoing research aims to refine these technologies further, sustain early detection, and minimize discomfort. The legacy of mammography continues as a vital force in the fight against breast cancer.